stomach. So that's the reason why we choose other painkillers, and that we try to stop the morphine in patients after 2-3 days.
Okay. Wow. I was really looking for the morphine, because when I take it, then it's like the pain quickly reduced, because I was really in severe pain for about 3 or 4 days. It was terrible. And when I was discharged, I had to be rushed again to the hospital. Yeah, because the pain came so severe.
One problem is that pain is something that is very, very individual.
Yeah.
If 10 patients undergo the same operation,
Yes.
maybe that patient 1 doesn't have pain at all, and patient 10 tells, I had severe pain for 4 weeks.
Yeah.
The pain is really, really individual.
Okay.
And so that makes it difficult to really find a good match in medication for every patient. And that's also the reason that we have to see how does the patient react if he is in the recovery room. You remember we had, after the operation, you're not going back to the ward immediately.
Yes.
But there is a recovery room where you're still on the monitor, where we try to make you as comfortable as possible with painkillers, with everything you need.
Yeah.
And well, there we have to decide what we do in the post-operatively phase with the pain of the patient. And because we expected that you would have quite a lot of pain, we gave you the catheter that you had in your bag.
Yes. So that is different from the normal one.
That is normally...
What did you call it?
We call it epidural catheter, and it's kind of local anesthetic that is given continuously through a little line into your bag.
Yeah.
And the local anesthetic will be given close to the nerves in your bag.
But you told me that was very risky, because you said if there's any mistake at the vein or whatever, that will cause paralysis.
It can cause problems, and that's the reason that we only do it in awake patients, because we want patients to tell us what they feel when we bring in the catheter.
Okay.
So, and if you tell us properly what you feel, if we do the procedure, then, well, I honestly haven't seen any problems in years. So
Yes.
also quite safe.
Right. So the nausea that people feel after surgery and the sore throat, is it part of the anesthetic medicine given to them?
Nausea.
Or is it as a result of the anesthetic medicine given to them?
Sometimes nausea is part of the anesthetic medication that patients get. There is a group of patients that is more where it's possible with more frequency that they will have nausea and vomiting after an operation. That are women, young women.
Okay.
And there are also certain types of surgery where it's more possible to have nausea and vomiting after the operation. But because we know this, we give nowadays, that was not so in when you underwent the anesthesia or the operation, but now we give every patient that comes to the hospital something against nausea and vomiting before we start with the anesthesia.
Oh, that's good then. Yeah, that's very good then.
Yes.
Wow. So, at what point will people receive blood infusion during surgery?
Well, if they lose a certain amount of their own blood, you have as an adult around 5 to 6 liters of blood in your body, that's normal. And if you lose a certain amount of it, and we see that the body can't deal with the blood loss alone, that the blood pressure is dropping too much, that the heart rate is going too high, that the patient will have difficulties recovering from the operation if we don't give some blood to him when we start with it. But well, we all know that blood is really, really expensive. That there are some problems that can be caused because of infections you can get from if you get blood from strangers.
Yes.
Also, it is very well investigated here in the Netherlands. But well, you can get some problems with blood donation. So we try to restrict it as much as possible.
But when I was waking up, I think I saw that blood was given to me. Was blood given to me during?
I honestly don't remember. I don't know anymore.
So before we round up, what are the common risks of anesthesia? What are the common risks from? I mean, tell us sincerely. What are the common risks involved in all of this?
Okay. If you ask a surgeon what are the common risks in surgery, normally he would say, well, maybe you have a bit pain, maybe you lose a bit blood, maybe you get a hematoma, but normally he also should tell you that some people have died on this sort of surgery, and it's the same with anesthesia. So if you ask me what are the problems that I have to expect with anesthesia, then maybe I'll tell you, okay, maybe you have problems with nausea and vomiting, maybe you have a sore throat because of the intubation, the little tube that is put into your throat to make it to make sure that you are breathing properly during the operation. Maybe you have a chance of an allergy if you don't have had anesthetic medication before, but really serious problems, really serious complications and side effects, we barely see. To be honest, I should, if I look to, for example, in America, an anesthesiologist or a surgeon has to tell people you have a chance of 1% or so to die during the operation, or you have a chance of 0.0% to don't wake up after the operation. It's not that strict here in the Netherlands. What we do, we inform patients about the common risks, common problems that we saw everywhere, every week, that we saw a few times a year. But well, it's not that we don't want to inform patients, but we also want to take the anxiety away from the patients.
Exactly. That's very important.
And the fear. And that's the reason that I'm not telling everybody you may die from anesthesia or you may die from surgery. Because that's really not true for most of the cases we saw every day.
Yes, it's true. So, are there any latest development in this field of medicine which you want our listeners to know before we sign off?
Well, anesthesia, like other specialties in medicine, is constantly in development. And I think the most important things that have been developed last years are all the possibilities for really, really sick patients to undergo anesthesia in a safe way. And that's because there are quite a lot of instruments and quite a lot of possibilities to measure every thing about lung and heart and everything in a patient during anesthesia. So I think it's the most important thing is to make it safer for the patients, and we're still busy doing this. And we're also looking at better ways for patients with pain after operations. We're also looking for patients with chronic pain. And the techniques that are possible in these fields are much more than, for example, 10 years ago.
Well, Dr. Gehlich, reading through your bio, I found out that you've really worked in this field for almost 24 years now. But why haven't you been to any of the third world countries at least to go and do something there?
I haven't been to what?
Any of the underdeveloped countries.
I have been there. I have been in Ghana.
Oh, really? Are you good at Really?
Yes, really. It's true. And I planned to go back and to work there for a while, but then I had little children in myself, and so well, it has not happened till now. But I have been there in a university hospital in Komati.
Yeah. Oh.
And I've been there for 2 weeks, just walking around a bit with a colleague from Nigeria.
Yeah.
To see what they are doing there, and to get an impression how anesthetic and surgery works in those kind of countries.
That would be nice.
And I've also been in Nepal.
Nepal, okay.
And in Kathmandu, I also have a university hospital, and I've been seeing surgery and anesthetic and also intensive care as well.
Wow. So when do you intend to go back to, at least go to Ghana and add to what we are doing over there?
Well, I would like to go tomorrow, but I think that's not possible. So hopefully I get back one time.
What is your advice for our audience regarding this important topic? Final word are you telling us before we sign off?
Well, my advice to every patient is be honest with the doctor. Tell everything that is necessary for surgery and for anesthesia, and don't refuse to ask any questions you want to ask. Because